This is Altura Now with Steve Eiliff.
Thanks for joining us. The effect of COVID-19 on the world is profound and it's evolving every day. But how is it affecting the care sector in Scotland? The workers, the people in care, and of course, loved ones and family. Joining me is Chief Executive of Scottish Care, Donald Macaskill. Donald, thanks for coming on.
Good to be here, Steve.
Donald, can you give us an overview of the current situation in Scotland with regards to COVID-19 and the care sector?
Well, like many countries, Scotland is facing the real challenge of COVID-19, and it has had a profound impact on the whole of our society, but especially on our care services, both care home and care at home services. So 25% of the deaths to date in Scotland have occurred in our long-term care facilities in care homes and 13% in care at home supports. So this is a profound impact on the whole of society. Some of our most vulnerable citizens are unfortunately losing their lives to this pernicious and evasive pandemic.
And it's incumbent upon us to protect these people as a nation, isn't it?
Absolutely. It's incumbent on any nation to look out for those who are unable to protect themselves. And that is precisely what the care home and the home care sector has been doing in Scotland. The difficulty is that this is a novel virus. This is new. We are all of us learning from one another internationally, and we're all of us learning each day because we know something today which we didn't know yesterday. So when this is over, at least this stage of pandemic, we will spend a lot of time reflecting on, could we have done differently? Could we have done something else? And undoubtedly the answers to those questions would be and will be yes. But we are trying to do what we can do with the knowledge we have and with the skills and resources we have available to us.
And I think there's going to be a lot of time to reflect on it because I don't think COVID-19 is going away anytime soon. But let's talk about frontline protection issues. There's a raft of measures and restrictions that apply in order to slow the spread of the virus. Can you run us through these?
So in Scotland, like in elsewhere in the world, we have been in lockdown for a significant period of time. So that basically has meant, that's 4 weeks ago from the moment I'm speaking, that has meant that any citizen is confined to their own house, except for the purpose of going for 1 hour exercise a day, to purchase essential provisions, or to visit and deliver care to somebody. Or indeed, if they happen to be a key worker working in the sectors which are required to keep our society going. Now that's having a profound impact on ordinary citizens, on their interaction, on their mental health and well-being. The care sector, 2 weeks before that in care homes in Scotland, we entered into a lockdown phase. And so we're now talking 6 weeks in from that period of time. And that is also having a profound impact in the delivery of care at care home level and also in our community.
And so they're difficult conditions to work under. How is the sector responding?
The sector is responding marvellously. It is part of the characteristic of Scottish people to be open, to meet a challenge, to do so with humanity and with dignity. Our frontline care staff in care homes haven't just been superheroes, they've been heroes of their humanity. They haven't just gone an extra mile, they've gone an extra marathon. Women and men leaving their own families, quite literally in some cases, and moving into their care facilities. Other women and men getting up every day, going to support some of our most vulnerable, despite the fear and the anxiety, and still delivering the highest quality of protective care and support. But our care homes are not ordinary places at the moment. Normally they are places of enjoyment, encounter and experience where life is full and individuals are encouraged to interact with their communities, with families. They are bustling, busy places. Today they are quiet. They are places of concern, places where individuals are isolated in their own rooms, where communal areas are quiet. And they are also places of distress because, as we will know, many individuals who live with long-term conditions such as Alzheimer and dementia don't understand what's going on. And so the sense of isolation, particularly if they become symptomatic and especially if they become COVID positive, is extremely distressing for those individuals. And that impacts on staff, it impacts massively on families, it impacts on the whole of society.
And every country around the world is experiencing logistics and supply chain issues. What steps are being taken to ensure supply of PPE and other items to our sector when there's so much demand from hospitals?
So there is, as your viewers will know, a global crisis around PPE. And in Scotland, what we did approximately 6 weeks ago was work closely with the Scottish Government to establish what we've called a triage system, where initially, if there were shortages, social care providers could access those supplies held nationally by the health system. The health system in Scotland, as many of your viewers might know, is government-led. The care system is predominantly made up of charitable, not-for-profit and private providers. So social care traditionally buys its own PPE. The challenge has been, however, the global shrinking, the reduction of market, the unavailability of supply, and also the disgusting degree of profiteering of some manufacturers and suppliers of personal protective equipment. That all has effectively meant that we are now, as a sector in Scotland, massively reliant on the government-funded national data and national source for supplies. And that's put enormous pressure on that. At the same time, we are absolutely overwhelmed by the creativity, the ingenuity of school children, of teachers, of manufacturers, from very different businesses, coming together and coming up with short-term solutions to some of our challenges. One of the examples of that, and many of your viewers will know that Scotland, we pride ourselves in our whisky industry. And some of our major distilleries have transferred production onto the production of alcohol gel for our care sector. So this is a coming together of a nation to care for those who need care, despite the global challenge and pressure around PPE.
During this time, we're certainly losing touch, certainly in a physical sense. And you talked about this a little bit before, but how important is it to keep in touch, and what can we do to protect the mental health of people in care and, of course, their families during this time?
So we recognise that keeping in touch, being connected, being related is an intrinsic part of what it means to be human. And what we're experiencing at the moment is a shattering of those connections. So all that we can do is to try to reconnect people and keep people in communication. So what Scottish Care has, for instance, done is established, in connection with entrepreneurs and others in the community, a tech devices network in which we're connecting those who have donated tablets and other devices with care homes and other facilities who need those. And we've seen marvellous examples of connection between families and individuals. We've had Mother's Day, we've had Easter Sunday, days of traditional connection. And what we're trying to do through that project and many, many others is to keep people connected. Our arts festival for older people in Scotland, which is called Luminate, has created something called Luminate at Home, which every day connects people up to dance, to music, to song, to story. Connection is important for mental and physical well-being, and we're doing all that we can in very, very unreal times to keep those doors of community and connection open.
And of course, there's immense pressure on staff at the moment as well. How do they stay resilient?
So staff are experiencing immense trauma. I think people don't often recognise that in a care home in particular, the connection between a staff member and an individual is a long-term one. It's over maybe many weeks, many months, and sometimes years. And to lose those people before their time, to lose many those that you know, is traumatic. And so we're working with hospices in Scotland to establish immediate help and support. We're working with Scottish Government to establish psychological trauma helplines for our staff. But I am always daily astonished at the stories of sacrifice and dedication which our wonderful women and men of care deliver. It's a shame to the rest of us in Scottish and in world society that we value those carers so lowly, that we pay them so poorly, and that we recognise them so rarely.
This is something that seems to be coming out in all countries every time we speak to somebody, that the pay is not commensurate with the importance of the role, and it's a real shame.
It's not a shame, it's a disgrace. We value those who touch and who deal with money greater than we value those who heal and care. And that's an indictment on our humanity, both in this country and elsewhere. And I do hope after this pandemic, and however long it lasts, we will reorientate what it means to be community, what it means to be related, and how we understand our obligations to one another. If we don't, then the sacrifices of the women and men who care, the sacrifices of a generation who are older and who are vulnerable to this disease will have been wasted.
And Donald, there's been confusion around how the COVID-19 restrictions affect visiting at end of life. How important is it for loved ones to be there at this critical time? And what's the best interpretation of the guidelines?
It's immensely important, not just for the moment, but for the days and weeks of grieving and bereavement which we will all experience. So in Scotland, we have been extremely clear about this, and we've worked with clinicians and our Royal Colleges of Medicine to put out guidance which is very clear that the individual should be present and enabled to be present at the moments of death. We talked earlier about touch, and I received an amazingly moving message from a woman who was present with her husband as he died. And she said that despite all the apparatus of protective equipment that she was wearing, she could feel the touch of his heart through her fingers. That is fundamental. It is of intrinsic value beyond description. And in Scotland, we are doing everything we can to make sure that at least one person is present so that nobody dies alone, and everybody dies with those who they know, who they want to be with, in as far as it is possible.
Wow. And the workforce, this is a big issue as well. Our frontline carers are vital. What's being put in place to maintain staff numbers and to ensure that the continuity of great care?
So obviously workforce is under huge pressure. There are people who are self-isolating for 7 or 14 days. There are people in our workforce which is predominantly female and predominantly older. There are those who themselves have long-term conditions and are being shielded, as the term that we're using in Scotland. And there are those who've got caring and family responsibilities and who therefore cannot come to work. So we are facing a real workforce issue, but I'm pleased to say that at very early stage, we together with our regulator established a RAG system, red, amber, green alert system, which means that if any care organisation gets to a stage at which there is uncertainty or alarm over staffing, then we have an immediate point through to supplement and to support that care home or that care at home organisation. We have been amazed that a call out to those who were formerly in care has resulted in nearly 3,000 applications, which may not seem a lot, but it's immeasurably useful and helpful, and over 20,000 those individuals who are medically trained, nurses, physios, etc., to come back to support. This is a joint effort. We are very much in it together.
Wow, it's amazing. It's amazing to see what humans can do when we come together to fight a common threat. But the sector has struggled for some time now. You know, there were problems in the sector prior to COVID-19. What are your thoughts on the future stability of the sector beyond COVID-19?
So I'm exceptionally worried. And what I'm concerned about is that we will win the battle and lose the war. And I mean by that we have in home care, for instance, loads of people who are at home caring for their family members and therefore who have stopped their contracts with care organisations. And those care organisations could go to the wall, making redundant thousands of workers. We've got care homes who are unable to admit new people to the community because their margins are so tight. They could go to the wall because they are unable to meet the pressures of exorbitant PPE and a level of PPE which they didn't ever conceive of, extreme expense as a result of additional staffing. So I'm deeply concerned about the sustainability of our social care sector in Scotland, as I think my colleagues are all over the world.
And what support are you providing to your membership during this crisis?
So, like many national organisations, we're a small team, but I have to pay tribute to my colleagues in that they are doing an immeasurable amount of work. So we have 2 weekly webinars involving clinicians and others, and these are astonishingly well subscribed. We've got a weekly update. We have transformed a whole section of our website with information for family members and general public, and information for those who deliver care. We've got a discussion board which is active. We've got weekly newsletters. We are appearing in the media virtually every day. We hold, on average, discussions with our cabinet ministers and secretaries of state at least 2 or 3 times a week. So as a small team with national reach, we've got staff in most of the areas of Scotland who are doing amazing work to support, to be present, to encourage and to enable. So again, it is, as you say, a collective effort, not just for us as a membership organisation, but to try to make the difference for the women and men who are doing the real hard work. And that is up and out there on the front line.
So what's your best advice for people working in the sector as we work together to fight this threat?
Probably my best advice is to say that this disease, this pandemic, will only ever be beaten by our humanity. Whether that's putting human beings in front of profit if you're a producer of PPE, whether that's thinking about humanity in the terms that you use and the language that you use as a politician, not seeking political advantage, whether it's thinking about humanity in the demands you make as a regulator, thinking about humanity in terms of the sacrifice given by staff who are going so far into their reserves of energy to continue to care, and to think about humanity at those times of emotional distress. We are all of us working in extraordinarily strange times. Sometimes words will be said which are not meant. Sometimes tempers will be lost which are not intended. We have to fall back on our humanity and realise that all of us, when we strip ourselves down, are equally vulnerable to this unknown, unseen enemy. And it is only our humanity and nothing else which will bring us through.
Great words, great advice. Donald Macaskill, thanks so much for joining us. We hope to see you again soon.
Thank you very much. Thank you.
And to all of you watching, please get your information from trusted sources and stay safe. I'm Steve Iliff. Join us again next time on Altura Now.